If you're over 50, a stroke can happen suddenly without warning and change your life in a matter of minutes. Many people believe strokes only come with dramatic symptoms, but the truth is, early warning signs are often subtle and easy to ignore. A brief weakness, trouble speaking, sudden dizziness, or changes in vision may seem harmless at first, but these signs could be your brain sending an urgent warning. Ignoring them could lead to permanent disability or even death. In this video, you'll learn 5 critical stroke warning signs people over 50 should never ignore, and why recognizing them early could save your life or the life of someone you love. As we get older, the risk of stroke increases significantly, especially after the age of 50. Stroke is one of the leading causes of death and long-term disability worldwide, yet many people do not recognize the early warning signs until it is too late. What makes stroke particularly dangerous is how quickly it can develop and how suddenly it can change a person's life. A stroke occurs when blood flow to part of the brain is reduced or completely blocked. Without oxygen and nutrients, brain cells begin to die within minutes. This is why early recognition and fast action are critical. The sooner a stroke is treated, the better the chances of survival and recovery. Many people believe strokes only happen to those with obvious health problems. In reality, strokes can affect people who appear relatively healthy. High blood pressure, diabetes, high cholesterol, smoking, heart disease, stress, and even dehydration can all increase stroke risk. After age 50, the cumulative effects of these factors become more significant. One of the biggest dangers is ignoring early symptoms. Stroke warning signs are often mistaken for fatigue, low blood sugar, vertigo, or normal aging. Some symptoms may last only a few minutes and then disappear. This is especially dangerous because it can give a false sense of reassurance. In many cases, these brief episodes are warning signs of a more serious stroke that may occur later. Another common mistake is waiting to see if symptoms improve on their own. When it comes to stroke, time is critical. Delaying medical attention can lead to permanent brain damage, loss of speech, paralysis, memory problems, or worse. This video is created to help people over 50 understand what their body may be trying to communicate. It is not meant to diagnose medical conditions or replace professional medical advice. The goal is to increase awareness so you can recognize warning signs early and act quickly. If you or someone around you experiences sudden changes in movement, speech, vision, balance, or awareness, even if they seem mild or temporary, they should never be ignored. Acting fast can save brain function and save lives. In the next sections, we'll go through 5 stroke warning signs people over 50 should never ignore. Some of these signs may surprise you because they don't always look like a typical stroke. Understanding them could help you respond correctly when every minute counts. Let's begin with the first stroke warning sign. One of the most common and dangerous warning signs of a stroke in people over 50 is sudden weakness or numbness on one side of the body. This symptom often appears without warning and can affect the face, arm, leg, or all 3 at the same time. Because it may be mild at first, many people ignore it or wait to see if it goes away. You may suddenly notice that one arm feels heavy or difficult to lift. One leg may feel weak or unstable when walking. In some cases, the face may feel numb, or one side of the mouth may droop slightly. These changes can happen in seconds and may not be painful, which makes them easy to dismiss. This warning sign occurs because a stroke disrupts blood flow to the part of the brain that controls movement and sensation. When brain cells are deprived of oxygen, they stop functioning properly. The result is weakness, numbness, or loss of control on the opposite side of the body from where the stroke is occurring in the brain. People over 50 often mistake this symptom for fatigue, a pinched nerve, poor circulation, or even sleeping in an awkward position. Some assume the weakness will resolve on its own. While symptoms may temporarily improve, this does not mean the danger has passed. In many cases, this sudden weakness is caused by a transient ischemic attack or thanks in advance. A thanks in advance is often called a mini stroke. Symptoms may last only a few minutes or hours and then disappear completely. This is extremely dangerous because a thanks in advance is a major warning that a full stroke may occur soon, sometimes within hours or days. One simple way to recognize this warning sign is to ask the person to raise both arms at the same time. If one arm drifts downward or cannot be lifted, this is a red flag. Another sign is difficulty gripping objects or dropping items unexpectedly from one hand. Facial weakness is another key indicator. Ask the person to smile. If one side of the face droops or does not move normally, this suggests possible stroke involvement. Even slight facial asymmetry that appears suddenly should be taken seriously. Leg weakness may cause sudden trouble walking, stumbling, or feeling unsteady. Some people describe the sensation as their leg not listening to them. This loss of coordination can increase the risk of falls and injuries. It's important to understand that stroke-related weakness is different from normal muscle fatigue. It often comes on suddenly, affects only one side, and does not improve with rest. The weakness may feel unfamiliar and alarming, even if it is mild. In some cases, numbness rather than weakness is more noticeable. You may experience tingling, loss of sensation, or a feeling that part of your body is asleep. If this numbness appears suddenly and affects one side of the body, it should never be ignored. People with risk factors such as high blood pressure, diabetes, heart disease, or a history of smoking are especially vulnerable to this warning sign. However, strokes can also occur in people without obvious risk factors, which is why awareness is so important. Another dangerous aspect of this symptom is denial. Some people feel embarrassed or fear causing a scene, so they avoid asking for help. Others worry about being wrong. Unfortunately, delaying medical care can lead to permanent brain damage. Time is critical when it comes to stroke. The faster blood flow is restored to the brain, the more brain cells can be saved. Treatments are most effective when given within the first few hours after symptoms begin. If you or someone around you experiences sudden weakness or numbness on one side of the body, even if it seems mild or temporary, call emergency services immediately. Do not wait to see if it improves. Do not attempt to drive yourself to the hospital. Acting quickly can mean the difference between full recovery and lifelong disability. Sudden weakness or numbness is never normal, especially after age 50. Next, we'll discuss warning sign number 2, which affects speech and communication and is another critical stroke symptom people over 50 should never ignore. Another extremely serious stroke warning sign people over 50 should never ignore is sudden difficulty speaking or understanding speech. This symptom can appear abruptly and may be mild at first, which is why many people underestimate how dangerous it is. You may suddenly find it hard to form words clearly. Speech may sound slurred, slow, or garbled, as if the tongue and mouth are not working properly. Some people know exactly what they want to say but cannot get the words out. Others may speak, but their words don't make sense. In some cases, the problem is not speaking but understanding. You may hear someone talking to you but have trouble processing what they are saying. Simple sentences may feel confusing, or you may respond inappropriately without realizing it. This can be frightening and disorienting. These symptoms occur when a stroke affects areas of the brain responsible for language, such as Broca's area or Wernicke's area. When blood flow to these regions is interrupted, the brain temporarily or permanently loses the ability to process language normally. People over 50 often mistake these symptoms for stress, anxiety, fatigue, or low blood sugar. Some assume they are just having trouble finding words, which can happen occasionally with aging. However, stroke-related speech problems appear suddenly and are noticeably different from normal forgetfulness. A common scenario is slurred speech after waking up or during a conversation. Family members or friends may notice the change before the person experiencing it does. Sometimes others describe the speech as sounding drunk, even when no alcohol has been consumed. Another warning sign is difficulty repeating a simple sentence. If you ask the person to repeat a phrase and they struggle, say the wrong words, or cannot repeat it at all, this is a red flag. Similarly, confusion when answering basic questions, such as their name, location, or the date, can indicate stroke involvement. Speech problems caused by stroke often occur alongside other symptoms, such as facial drooping, weakness on one side of the body, or vision changes. However, in some cases, speech difficulty may be the only noticeable symptom at first. Transient ischemic attacks, or TIAs, commonly cause brief episodes of speech difficulty that resolve within minutes or hours. Because symptoms disappear, many people do not seek medical care. This is extremely dangerous, as a thanks in advance is a strong warning that a major stroke may follow. One reason speech symptoms are ignored is embarrassment. Some people feel self-conscious or worry about overreacting. Others believe they will feel better after resting. Unfortunately, waiting can allow brain damage to progress. It's important to understand that the brain cannot tolerate oxygen deprivation for long. Every minute that passes during a stroke results in the loss of millions of brain cells. Quick treatment can limit damage and improve recovery outcomes. If you suspect someone is having trouble speaking or understanding language, do not argue with them or wait for clarity. Ask simple yes or no questions. Look for other signs, such as facial drooping or arm weakness. Most importantly, act immediately. The FAST test is a helpful tool. Face. Ask them to smile. Does one side droop? Arms. Ask them to raise both arms. Does one drift down? Speech. Is speech slurred or hard to understand? Time. If you see any of these signs, it's time to call emergency services. Speech problems after a stroke can lead to long-term communication difficulties, affecting independence, relationships, and quality of life. Early treatment can reduce the severity of these outcomes. If you or someone near you experiences sudden trouble speaking or understanding speech, even if it lasts only a few minutes, treat it as a medical emergency. Do not wait for it to pass. Next, we'll move on to warning sign number 3, which involves sudden vision problems and is another stroke symptom people over 50 often overlook. Sudden changes in vision are another critical stroke warning sign that people over 50 should never ignore. Vision problems related to stroke often appear without pain and may come on very quickly, which is why many people underestimate how serious they are. You may suddenly experience blurred vision, double vision, or partial loss of vision in one or both eyes. Some people describe it as a dark shadow, a curtain coming down over part of their visual field, or difficulty seeing clearly on one side. Others notice flashing lights, spots, or difficulty focusing. These vision problems occur because a stroke can disrupt blood flow to areas of the brain that process visual information or to the optic nerve itself. When oxygen supply is reduced, the brain can no longer interpret visual signals correctly. People over 50 often assume vision changes are related to eye strain, aging, cataracts, or the need for new glasses. While these conditions can cause gradual vision changes, stroke-related vision problems are typically sudden and noticeable. One common warning sign is vision loss in one eye, sometimes called amaurosis fugax. This may feel like temporary blindness or dimming in one eye that lasts for minutes and then resolves. Because vision often returns to normal, many people do not seek medical attention. This is extremely dangerous, as it can be a warning sign of an impending major stroke. Another symptom is double vision, where objects appear duplicated or misaligned. This can make it difficult to read, walk, or judge distances. Double vision caused by stroke may appear suddenly and may worsen with movement. Some people experience difficulty seeing on one side of their visual field, known as visual field loss. For example, you may only see objects on the right side and bump into things on the left, or vice versa. This can happen even though your eyes themselves are healthy. Vision problems related to stroke can also cause dizziness, nausea, or a feeling of disorientation. This can increase the risk of falls and injuries, especially in older adults. It's important to understand that vision-related stroke symptoms are not always dramatic. They may be subtle at first and easy to dismiss. You might think your vision is off or that something just doesn't look right. Trust this feeling. Vision changes caused by transient ischemic attacks, or TIAs, often resolve quickly. Because symptoms disappear, people may believe the issue has passed. In reality, a thanks in advance is a serious warning that a full stroke may occur soon. Another reason vision symptoms are ignored is because they may not occur alongside pain. The absence of pain can lead people to believe the problem is not urgent. However, stroke-related vision loss is a medical emergency regardless of pain. People with conditions such as high blood pressure, diabetes, heart disease, or irregular heartbeat are at higher risk for stroke-related vision problems. Smoking and high cholesterol also increase risk. If you notice sudden vision changes, ask yourself these questions. Did the change happen suddenly? Is one eye or one side affected more than the other? Is vision blurred, doubled, or partially missing? Did the change come with dizziness, weakness, or confusion? If the answer to any of these is yes, seek medical help immediately. Ignoring vision problems can lead to permanent vision loss or severe stroke complications. Early treatment can restore blood flow and prevent further damage to the brain. If you or someone around you experiences sudden vision problems, even if they improve or disappear, call emergency services right away. Do not wait for an eye appointment or assume it will resolve on its own. Vision is one of the brain's most complex functions. Sudden changes are often the brain's urgent signal that something is wrong. Next, we'll discuss warning sign number 4, which involves sudden dizziness, loss of balance, or coordination problems. Another stroke symptom people over 50 frequently overlook. Sudden dizziness or problems with balance and coordination are another major stroke warning sign people over 50 should never ignore. These symptoms are especially dangerous because they are often mistaken for vertigo, low blood pressure, dehydration, or simply standing up too fast. You may suddenly feel lightheaded, unsteady, or as if the room is spinning. Some people feel like they are about to faint. Others notice difficulty walking straight, maintaining balance, or coordinating their movements. These symptoms can appear without warning and may worsen quickly. Stroke-related dizziness occurs when blood flow to areas of the brain that control balance and coordination, such as the cerebellum or brainstem, is disrupted. When these areas do not receive enough oxygen, the brain struggles to maintain posture, movement, and spatial awareness. People over 50 often dismiss sudden dizziness as a normal part of aging. Others assume it is caused by inner ear problems, low blood sugar, or fatigue. While these conditions can cause dizziness, stroke-related dizziness is typically sudden, intense, and unfamiliar. One concerning sign is dizziness combined with difficulty walking. You may feel as though your legs are not responding properly or that you are being pulled to one side. Some people describe a sudden loss of control over their body movements. Coordination problems may show up as clumsiness. You might drop objects, have trouble buttoning clothing, or struggle with tasks that normally feel easy. These changes can occur suddenly and without explanation. Another warning sign is trouble maintaining balance while standing or sitting. You may feel unstable even when not moving. This can increase the risk of falls, which can be especially dangerous for older adults. Nausea and vomiting may accompany stroke-related dizziness. This combination often leads people to believe they are experiencing food poisoning or a stomach virus. However, when nausea appears alongside sudden balance problems, stroke should be considered. Some strokes, particularly those affecting the brainstem, can cause severe dizziness without other obvious symptoms at first. There may be no pain, no weakness, and no speech problems initially. This makes dizziness-only strokes particularly easy to miss. Transient ischemic attacks can also cause brief episodes of dizziness or balance problems that resolve within minutes or hours. Because symptoms disappear, many people do not seek medical attention. This is dangerous, as a thanks in advance is a strong warning that a more severe stroke may occur soon. It's important to pay attention to how dizziness begins. Stroke-related dizziness usually starts suddenly and feels different from previous episodes. It may feel overwhelming or frightening rather than mild or familiar. Ask yourself, or the person experiencing symptoms, did the dizziness begin suddenly? Is it severe or different from past episodes? Is there difficulty walking or standing? Are movements uncoordinated or clumsy? Are there other symptoms like vision changes or nausea? If the answer is yes to any of these, immediate medical attention is needed. People with high blood pressure, heart disease, diabetes, or a history of smoking are at increased risk for stroke-related dizziness. However, strokes can occur in people without known risk factors, which is why symptoms should never be ignored. Waiting to see if dizziness improves can be extremely dangerous. Brain cells begin to die within minutes during a stroke. Early treatment can reduce damage and improve recovery. If someone suddenly becomes dizzy, unsteady, or unable to coordinate their movements, do not let them walk alone. Help them sit or lie down safely and call emergency services immediately. Do not attempt to drive to the hospital. Emergency responders can begin treatment and monitoring right away. Dizziness and balance problems are not always harmless. When they appear suddenly, they may be the brain's urgent warning that a stroke is occurring. Next, we'll move on to warning sign number 5, which involves sudden, severe headache and changes in awareness. Another critical stroke symptom people over 50 should never ignore. The 5th stroke warning sign people over 50 should never ignore is a sudden, severe headache or a sudden change in awareness or consciousness. While not all strokes cause headache, when this symptom appears, it can signal a very serious and potentially life-threatening event. A stroke-related headache often comes on suddenly and is unlike any headache you've experienced before. Many people describe it as the worst headache of their life. The pain may be intense, sharp, or explosive, and it can appear without any clear cause. This type of headache is especially associated with hemorrhagic stroke, which occurs when a blood vessel in the brain ruptures and causes bleeding. The sudden pressure and irritation in the brain can lead to severe pain and rapid neurological changes. In addition to headache, you may experience confusion, trouble staying alert, or difficulty responding to others. Some people feel suddenly disoriented, drowsy, or unable to focus. Others may lose consciousness entirely. People over 50 often dismiss severe headaches as migraines, tension headaches, or stress-related pain. While migraines can be painful, stroke-related headaches typically feel different. They appear suddenly, escalate quickly, and are often accompanied by other symptoms such as nausea, vomiting, vision changes, or weakness. Another concerning sign is sudden confusion or altered mental state. You may feel disconnected, have trouble understanding what's happening, or struggle to recognize familiar people or surroundings. These changes indicate that the brain is not functioning properly. Nausea and vomiting may occur alongside a stroke-related headache. This combination can cause people to assume they are dealing with food poisoning or a stomach illness. However, when vomiting occurs with sudden neurological changes, stroke should be considered. Some people experience sensitivity to light or sound, further complicating the picture. While these symptoms can also occur with migraines, the sudden onset and severity are key differences. Loss of consciousness, even briefly, is a medical emergency. Fainting or collapsing during a headache should never be ignored, especially in people over 50. It's important to remember that stroke symptoms do not always follow a predictable pattern. A severe headache may appear alone or alongside other warning signs, such as speech difficulty, vision problems, or balance issues. If you or someone around you experiences a sudden, intense headache that feels different from usual or sudden confusion, drowsiness, or loss of awareness, call emergency services immediately. Do not wait for the pain to subside. Recognizing stroke warning signs can save lives. Weakness on one side of the body, trouble speaking, vision changes, dizziness, and sudden severe headache are all signals the brain may be in danger. If you are over 50, it is especially important to listen to your body. Never ignore sudden changes, even if they seem mild or temporary. Acting quickly can prevent permanent damage and improve recovery. If this information could help you or someone you care about, share this video. Awareness saves lives. Remember, when it comes to stroke, time is brain.